Justin Hayes here, and you are tuned in to the Superhuman Show. We talk breathing, we talk movement, we talk posture, but more importantly, we talk about how these things correlate to fitness and your fitness goals, because the reality is that those things tie so closely in to your performance, how strong you can get, how athletic you can get. There is a strong, strong relationship between those two things, and that's the point we try to hammer home on this show. In this week's episode, I'm doing Breathing 101, diving a little bit deeper into it, once again with my buddy, Dr. Eric Dixon. Stay tuned. Hope you enjoy. All right, back here at the lovely studio of Sports Cairo, here with Dr. Eric Dixon, my good buddy. What's up, doctor?
How we doing today?
Not too bad. So we recorded this once before. I deleted it. My bad. We're going to talk about breathing, and we covered it in depth the first time. We did a damn good job, but this I lost the recording. So we're tackling it again, and really what we're going to do in this show is answer three questions. What is bad breathing? What is good breathing? And what you can do to improve your own breathing. So we'll start with what is bad breathing, and this is where you take the reins, doctor.
Yeah, so bad breathing is really assessed by a physician or by your trainer, and really probably the worst thing we can start with is, do you breathe backwards, aka paradoxical breathing, okay? And what that is basically when you take a deep breath in, does your belly button draw inward, okay? That means that you're actually breathing backwards. Your patterns have been confused, and you believe it or not, there's a large percentage of the population that thinks when you take a breath in, your stomach should be drawn in. And when you take a breath out, your stomach should balloon out, which is actually, in fact, the opposite of what should be happening. The lungs expand. That lung tissue needs some place to expand. The diaphragm has to come down. So in turn, your belly expands in 360 degrees all the way around your your waistline, and it makes for proper use of the diaphragm against the pelvic floor.
And so paradoxical breathing is just, that only happens at a certain percentage of people. You can still have other poor breathing patterns as well,
Absolutely.
Right? Where you get into the upper chest breathing and you're breathing through there and stuff. Talk a little bit about that.
Yeah, so basically, if you're not paradoxical, there's still a likelihood that you are breathing, there's a higher population than even the paradoxical breathers that have poor breathing patterns as well.
Right.
It could be stemming from poor posture. It could be stemming from, the things you do on a daily basis. Bad movement patterns, absolutely. But if you can imagine doing a bicep curl all day long with a small weight, every time you take a breath or every time you're breathing, you're doing a bicep curl. Now imagine you're doing that with your shoulders and your shoulder shrugs, and you're breathing all upper body in a very chest breathing type pattern.
Right.
That's exactly what you're doing. You can imagine by the end of the day, your upper traps, scalenes, neck musculatures are on fire and just had it.
So your comparison there is kind of like, hey, if I do a 1,000 bicep curls improperly, then think about what's going to happen to my shoulder and my bicep and what kind of problems I'm going to have there. Now, this is realistically true for someone that breathes improperly. They're doing thousands of repetitions improperly. And you kind of framed this up to me before, that the paradoxical you only see in a certain percentage of people, like
Correct.
1 in 3 or maybe less, right?
Probably less than that. Yep.
And then, but what we do see, I've seen in your office and just generally from training general population people, is we do see tons of improper breathing where you're breathing through your chest, your ribs are flaring, your shoulders are hiking up, your neck is on fire, just like you described. This is, what do we, if we're putting a number on bad breathing, I'm like this 9 out of 10 people, maybe more.
An epidemic. It really is an epidemic. And the reason being is, and I think I'm going to put the biggest blame on society and, mainstream media, putting the skinny girl out there that, basically is so skinny that people are trying to suck in their gut to not look, like they're bloated or things like that, or putting on the skinniest pair of jeans they can and having to basically lay on the bed to get the button. And I know lots of people out there have done that.
And this is, I see what you're saying too, because we look at these pictures, you and I all look at pictures in magazines, and we see them from an entirely different viewpoint than the general population would, because they're doing things like creating lordosis in their back to hike their butt up. They're actually using poor posture and accentuating it in almost like a sexual manner, right? Like
aesthetic purposes.
For aesthetic purposes. And so we get wrapped up in aesthetics, particularly females,
Absolutely.
100%. And then once you lose that posture in that lower region, I mean, you're setting yourself up for bad breathing.
Bad breathing that then in turn leads to poor movement patterns, and then in turn leads to an injury. So along the lines of those patterns, in that sequence, I can say, you know. So, and I think probably the biggest thing is that, you know, we can look at an individual, even if he has that six-pack abs, and you can see, you know, his inguinal line of his hip down to his, you know, that's a poorly functioning, you know, abdominal wall, if you ask me, and diaphragm.
And I think what you're really hammering here is that just because you look beautifully aesthetically, it really doesn't mean you're breathing good. You could be breathing completely improperly, you know, very poor patterns, and still be in shape, be skinny, whatever your definition of fitness is.
Right.
People, and that's why we're saying here, 95% of people have poor breathing patterns, because it is an epidemic, as you said, and it doesn't always correlate to, oh, you look beautiful, oh, that person's in shape, so we automatically assume they probably breathe well. Not the case.
Well, and this is kind of a correlation that I always thought was pretty interesting. But if you think about the little karate guys that are short in stature, they have a little bit of a rounded belly.
Right.
They're very functionally sound. Most of them are gymnasts if they're into the karate and doing things like that, and you know, that type of thing. But they're not concerned with the fact that they don't have chiseled abs, and you know, are you know, they have a little bit of a rounded belly, and for stability purposes, it's designed to stabilize the body and using the diaphragm and breathing in the proper manner.
Yeah, I've seen this also comparison done where if you look at UFC fighters, particularly as you get into the heavier weight classes, you'll look at their, their belly region, and you can see that it's kind of like they've got a little bit more girth there, because respiration is so important to their sport. They have to master it almost, to endure the type of physical, things that they're going through in those moments. So, yeah, that's definitely a good point. I'm glad we brought it up. So, what is good breathing? It should be pretty simple for us to do, since we just summed up bad.
I think we just covered all the terrible points.
Right.
On to the good type. Basically, the diaphragm comes down. Your rib cage is not flared up. That's a very big problem that we see in the population, is having the ribs so flared up, and you'll even notice that people will tell you, or friends will tell you, or, I have these rib cage, my ribs just stick out so far.
Right. Aesthetically, people have came to us and said, naturally, my ribs just flare up.
I have big ribs, or I have a barrel chest, or, things like this, which barrel chest is actually a medical diagnosis, for emphysema and things like that, but we won't even go there. Basically, you need the rib cage to be able to come down. Now, where do you get that from? From thoracic extension as well. So thoracic extension comes into play here, with developing maybe improper breathing, which can in turn lead to your posture, and so on. You can see the continuation there. And
when you're talking about thoracic, for people kind of missing that's just the upper back area, right? I mean,
upper back area, mid back area. Obviously not the neck and not the low back. So,
and when you say thoracic extension, it's kind of like if you're not mobile through that region, then you're not going to be able to get extension, and therefore your breathing patterns are going to suffer because of it.
Right.
And the same thing, lack of hip mobility is going to cause similar problems.
Absolutely.
In the way you breathe. It's that joint by joint theory that, hey, the thoracic above and the hip below are going to affect the way you breathe, but in turn, breathing affects how those guys are going to function as well.
Absolutely.
So good breathing, to sum it up, is ribs are staying under control. You're taking a deep belly breath, and you're breathing kind of like in a plunging motion down towards your pelvic floor, towards your hip region, right? And you're expanding 360 all the way around. That's how you would describe it?
I kind of describe it as that, but also I use the analogy of, think about a piston or a hydraulic system. The lungs come down, the diaphragm comes down. I'm sorry, the lungs don't go anywhere. The lungs inflate, the diaphragm comes down, and it pushes against, or it increases that internal abdominal pressure. So your guts, your stomach, your intestines, things like that, it creates an internal pressure, such as if you're bearing down to go to the restroom. You're going to push against the pelvic floor, which creates a stability type thing. So you would do that same type of manner if you were about to get punched in the stomach. You would brace all the way around 360 degrees and kind of lock that in. That's the stability type of a posture. That inflation process happens in 360 degrees around the waistband, even in the back. And you can feel that if you lay down with, either a tennis ball, something in your low back, and just feel that, pressure increase against the tennis ball.
And most people, when they get back into better breathing habits, they'll maybe get it in the frontal part of their belly first. You'll start feeling that deep breath there, but you need to work it to a point where it's 360 degrees and you do feel it in the back, just like you described. And I think the one thing I always like to tell people too is that motion right there, what happens, sets the tone for every movement you make with your body. That's it. That is the center point that you move off of.
That's your rock.
That's your rock. So I mean, You're moving your arm, trust me, you've got to breathe and control that and get stabilized there before you start to move your arm, before you start to kick your leg, before I do any sort of movement with my extremities. And that's why it is so important. That's
where they use the the analogy, you can't shoot a cannon out of a canoe.
Right.
If the stabilizing portion isn't stable enough to hold, you will get no power out of the rest of the extremities. So
true. I mean, we could. I don't know how we emphasize that anymore by just saying it, but please understand how important that is. If you're listening out there, please, it's so important, so powerful. So part 3, Doctor, what can we do? You and I are going to go back and forth here. What can we do to improve breathing? What do you do with patients on a day-to-day basis?
I think the biggest way is you got to assess whether you have a breathing problem. And I think the biggest way to kind of test for that is to simply lay on your back, bend your knees, and place one hand on your belly, one hand on your chest, and just notice what each hand is doing. Is your bottom hand rising and falling with breaths in and out? And is your upper hand moving at all? So I'll lay a patient down and I'll say, okay, now place your hand on your stomach, place your hand on your chest, and I'll just watch. So the biggest thing is watching, and, even if you need to look in the mirror or, record yourself doing this, it would be a good idea to assess what's going on first with each portion of the body. So,
and most people will, it's noticeable, right? You notice that one hand moves, or you're having some sort of movement in that upper hand and not so much in the lower. And
absolutely.
It's it's the biggest cue right there, then and there.
Right. So then to kind of start correcting it, we go into mainly just keep that upper hand still and only breathe through the belly.
Right. Or the exercise is the assessment.
Right.
It's the beauty and the simplicity of it.
Absolutely.
So. And then, I take it a step further, and I mean, I think you do the similar pattern. If they get it there, then you turn them over and maybe do crocodile breathing. But I've also had it where I've seen people that I have them on their back, and I put them in that position, and they actually have trouble making the correlation there. But then all of a sudden, you put them on their belly, and that floor kind of provides pressure
gravity
against.
Yes,
it's gravity.
it does,
Something's
absolutely.
going on there,
Mm-hmm.
and people, all of a sudden something clicks there. But either way, both of those are excellent things. For me, personally, from an exercise standpoint, I like to get into a deep squat position, or even just get into half kneeling and really focus on those same principles that we talked about, keeping my ribs, keeping everything in my upper area quiet, and taking deep diaphragmatic breaths, making sure I'm getting 360 degrees. And those are the progressions, right? If I can do it standing, if I can do it laying on my back, then I want to start to do it in extended ranges of motion. And that's been powerful for me. So
right. And that makes complete sense. I mean, you have to increase the stability of the proximal center in order to gain mobility of the extremities or the distal.
Right. So if you want to move your extremities and you want to move them well, get the centerpiece right first. Get the foundation right.
Absolutely.
You got to get it right. And now, what I kind of want to dig a little bit into, I know we don't want to get too medical or too advanced here, But if you can't get breathing, if you can't get it on your own, if you can't get it from an exercise standpoint or doing the simple stuff we like, there are professionals who have means, such as yourself, to take this to another level.
Absolutely.
And I mean, at what point do you think a person decides, hey, I want to go in and get that checked out?
I think if you really have tried a lot of different things and you assess and you aren't able to get it, and maybe you're having some pain, or even if you're not having pain, it's always a good thing to have your breathing checked out by a physical therapist, a chiro. I don't know if a medical doctor would necessarily assess in the proper manner.
We don't know.
I don't know. I don't want to pigeonhole anybody into that, but
in general, though,
right. And in general, I would say someone that's skilled in DNS, dynamic neuromuscular stabilization, is probably one of your best bets, because the whole technique is designed around the diaphragm breathing and things like that. So,
and there's other modalities that same principles of DNS, but just you're looking for somebody who does understand breathing. That's the most important part. They understand how important it is, how to train it, how to passively, assist.
Absolutely.
With it.
And help you understand how to do that. Maybe it's giving you a cue. Maybe it's putting you in a position where you have to load different weights in order to, stabilize yourself, to trigger your diaphragm to come down, your ribs to come down, to put you into a situation where you either basically sink or swim,
Sure.
When it comes to stability, either you can lift this weight and maintain other, body movements, or maybe you can't. And so at that point you can either regress or progress.
So I'm going to take a little bit of a different stance. You said, if you don't get it, if you have trouble after a couple tries, I would say that if you were at all worried or concerned about your breathing and you can't establish it at home very easily and simply, I would get to someone who knows what they're doing as quickly as possible. I know you'd probably say the same thing, but I want to stress it that I've seen you get someone to breathe properly within minutes, whereas that may take that person sessions at home on their own, trying to recreate what you just recreated.
Easy fix to at least change it at a conscious level. Now, changing it at a subconscious level where you're doing it and you're not even thinking about it, you're doing it, you look down and you're at a red light and you're doing it automatically. That takes a lot more training and a lot more reps. But at least at that point, when you get it fixed, you know what to expect.
Right.
Whereas not knowing what to expect.
Right. I mean, and every good pattern starts with consciously doing it, and then it shifts to an unconscious. It's just replicated. For example,
from where we lost it, yes.
From where you lost it, right.
Because if you take a baby, for instance, a baby is neurologically perfect. It will breathe. You see the whole torso expand. The belly is rising up and down, and it's just natural for them. So it's at a subconscious level.
Right.
Whereas we lose that function throughout. Maybe not everyone, but a large percentage of the population loses the ability to breathe with their belly and with their diaphragm. And then we go into see other dysfunctional patterns. So
definitely. Well, good stuff. I think that's it for us. We covered our 3 bases. I hope you guys got some good takeaways from that. Any questions, the doctor and I are always available. Doctor, your email, your Twitter handle, go ahead.
Yeah, you can reach me at sportchiroplus@gmail.com, or you can go ahead and tweet me at sportchiroplus. Plus is spelled out, and feel free to like us on Facebook as well.
Definitely. So I'm at superhumanpursuits.com, Justin at superhumanpursuits.com, and I'm on Twitter at Justin M. Hayes. But if you are not going to remember this, haven't written it down, no big deal. Go to superhumanpursuits.com, click on Superhuman Show. I got all the doctor's information there. I got all my information there. Easy to reach out to us, and please don't be shy. We have no problems answering any questions. We would love to in any way, or guide you to professionals or any assistance you would need. That's it. We'll talk to you guys next time. Appreciate it.
Thank you.